If you're getting a beard transplant, you need to know about the side effects.
In this video, you're going to see what to expect, and we're going to show you how to take care of the issue.
I'm Dr. Anthony Furl, and I'm the head of Philadelphia Hair Restoration.
I am Dr. Nam, Assistant Director at Philadelphia Hair Restoration.
If you have more questions about what to expect after a beard transplantation, check out our playlist. So what is a beard transplant? Well, a beard transplant is transplanting hairs from a donor site, most common somewhere in the scalp, to the facial area to provide a beard or enhancement to a beard that you already have. So beard transplants mostly common for people that are struggling to grow a dense beard, have had a beard that is showing signs of thinning, and they want to enhance the given beard they have. The age group generally that we would recommend for the beginning of beard transplants, generally speaking, is after age 20-25, and it can go indefinitely to any age group.
What are the common side effects with the beard transplant? The common side effects including swelling, mild bruising, or redness on donor or graft area. But these things are not really side effects. It's just things that happen because you go through the surgery. And usually these are also all part of natural healing process and usually goes away, subside within 2 to 3 days. You don't really need any medications unless you have severe pain, but it's more of mild discomfort rather than pain, and you just let them have their own course take and usually subside anywhere between 2 to 3 days from the surgery.
So what are the long-term effects of beard transplants? One of them could be, we talked about this in an earlier video, it's called folliculitis, and that can happen either in the scalp or the beard, which is kind of an ingrown hair. Well, so there could be various little folliculitis would represent itself or show itself, such as a pimple, let's say. And that is rare, and it can happen in few isolated areas, either even a year or even greater than a year. It's really not a concern. It could be taken care of simply by good hygiene. So that's one. Other than that, scarring, although mentioned, is really rare. The transplanted hairs are placed in a small little micro opening puncture in the skin. So there's really no scarring to speak of. So people are also concerned sometimes about patchy or uneven hair growth. It's very important that when you seek an expert provide your hair transplantation, that you perhaps ask for before and after photos, but even more importantly than that, you communicate exactly what type of hairline, beard line that you want. Some people, especially a lot of men who are recipients of near 100% of beard transplants, want a very sharp hairline of the beard. Other people would want a more natural look. You need to communicate this to the transplantologist, your surgeon, that, for example, you want a very even line if you want that. If you don't want it to be even and want it to look a little bit more, quote, natural, and not have that look, communicate that to them, and then we can easily provide the kind of results that you want. If you do notice any patchy areas that you expected beard growth and there's no growth in those areas, then you should contact us, and this again would happen after about a year, and then you can have a touch-up procedure in those areas to increase the growth where and not be as dense as you would like.
Which factors could influence the side effect? Post-op care hygiene is really important. You have to make sure that you keep that area clean, keep it away from any possible infection going on. And other factor is that, of course, you do need to find a good surgeon who can perform the job right for you. Meaning the beard transplant is a little bit different from the scalp transplantation, because in order to build up more density, we need to pick and choose the right follicles. For beard, usually all the time we use either single or double follicles. But hair, in order to build more density, we could go up to triple or quadruple follicles, but that's not going to look really natural in the beard. So those things are one of the factors that could affect the outcome. Not only that, it could also relate it to any side effects that could happen.
So another circumstance that can affect side effects is simply your skin type. If you have a light complexion, for example, and you notice that in general you're sensitive to sunlight and you'll break out, for example, or have blotching or whatever the case may be, your own inherent sensitivity could have a result in how much inflammation you have, for example, from hair transplantation. So different individuals will show a little bit different sensitivity, not vastly, but somewhat. And that is not relative at all to the surgical skill. It has to do with your skin sensitivity, but it's not going to affect the final result of the success of the ear transplant. So signs of infection sometimes can overlap with normal side effects. For example, itching. One can see itching with a true infection, and one can see itching just secondary to the irritation from the procedure. Hallmarks of infection do include redness, but that's going to be there as well. Heat generation or warmth, excessive warmth in, let's say, one particular area of your face could indicate that you may have a localized dermatological infection in that area, or certainly fever, which is a hallmark of infection across the board. Those are almost unheard of, especially the fever, but those would be signs that if you experience any of those, you certainly should give us a call immediately so that we can look into the cause and treat it.